All right, welcome to the Radon Information Session. I'm going to introduce the group that we have here with us tonight. So Asha Delisle and Vandana Bharti, thank you so much from the town of Creston. We really appreciate you joining us this evening and then also helping us connect to the community. And it's a free program for communities, but it does take staff time to advertise and help us distribute and that sort of thing. So we really appreciate you both, and I'm sure there's probably others behind the scenes helping. So thank you so much for bringing us to the community. All right, and then also joining me tonight is Dr. Anne-Marie Nicol from the BC CDC and SFU. Thank you so much, Anne-Marie. I'm going to let you start us off.
Thanks, Pam. And I am, can you hear me? Yes?
Yeah.
Okay, excellent. It's an honor to come and talk to people from Creston. My family's motorhome once broke down on the Salmo Creston Highway, so your part of the province is still one of my best summer vacations because we got stranded in your beautiful part of the world and it was fantastic, much better than where we were going in Alberta. So I'm pleased to be back. And I am a professor at Simon Fraser University, but I'm also a person who works at the BC Centre for Disease Control to help with the radon portfolio in the province. And I work with Pam, helping to talk to people about radon across the country. And tonight I'm going to start by talking a bit about how radon influences your health. And then Pam's going to talk about how to fix it. If you have radon in your home, we'll talk about how to test, and then we'll hear about the 100 Test Kit Challenge. And just to say that we are a national program, and we're proud to encompass the territories of the First Nations, Métis, and Inuit people who live across the country, and we respectfully honor people's rights, histories, and relationship with the land. And I am calling in this evening from the traditional and unceded territories of the Musqueam, Squamish, and Tsleil-Waututh people here in East Vancouver. So next, please, Pam. Okay, so you may never have heard of radon gas before. And if you hadn't, or you just heard the word and you didn't know what it was, you are in excellent company. Statistics Canada, when they do the census, some people get selected to do an extra survey, some about your household. Sometimes people do one about their energy use. Like there's this extra questions on some of those census. And one of them has to do with radon gas. So since about 2015, the government's been asking people what they know about radon. And while it has increased in proportion, it is still less than 50%. So if you came here not knowing much about radon or what it was, just know that you are not alone. And that after this presentation tonight, you are going to ace the census. I promise you, you'll be able to answer all the questions correctly. So that's going to be good. But if you haven't heard of radon, you might be surprised to know that it is the leading cause of lung cancer in people who don't smoke. And then if people do smoke, it's an important additive risk because it really significantly increases people's likelihood of developing lung cancer. So radon and smoking don't mix at all. Next, please. So how do we know that radon causes cancer? And this is actually an interesting and Canadian question. In the 60s and onward, there were people who were working in uranium mines and hard rock mines in Canada, the United States, and in Europe. But they started cohort studies here in Canada because people were dying of lung cancer. And people who were working in the mines, healthy men working in the mines were getting lung cancer. And it was like, well, why is this happening? And not all of them were smokers. And so they started to measure the different exposures that occurred in the mine. And what they realized was that part of the breakdown of uranium is a gas called radon gas. And it is this gas that was heavily correlated with lung cancer. And so it's very clear that exposure to radon gas leads to lung cancer. And all of the international organizations that designate carcinogenicity clearly agree. This is an IARC monograph, the World Health Organization, the US EPA, all have regulatory recommendations and guidance around preventing lung cancer by reducing radon exposure. And Health Canada has estimated that over 3,000, it was about 3,200 people in Canada, which is a lot. It's about 9 a day. People die from radon-related lung cancer each year. Next, please. So as I mentioned before, radon and smoking really don't mix. So if you have high radon in your home, your risk of developing lung cancer is 1 in 20. That is significantly higher than the risk of getting in a car accident or having your house burned down. However, if you smoke, it's 1 in 3. And if you don't have radon exposure and you smoke, you aren't necessarily guaranteed to get lung cancer. So there's something about the 1-2 punch of radiation and tobacco smoke and complete combustion byproducts, PM 2.5, together, those two things really increase people's risk of developing lung cancer. And people often say to me, well, I've quit smoking. Is that still a problem? And it does seem likely that even people who were ever smokers, as they're called, they're not current smokers or former smokers, still have an elevated risk, although it's not as high as people who currently smoke. So if you do smoke or you live in a household with people who smoke still, it's really important to reduce your radon levels. It's far easier than quitting smoking tobacco, and it may help reduce the impact on your lungs. Here in British Columbia, our public health physician who's assigned the radon role is very keen on investigating this relationship between tobacco and radon exposure to the point where we have some free public resources we'll show you in a minute, but they clearly differentiate the risk between smokers and and non-smokers. And this is unique in Canada, but he is very keen to follow up on this work. And so what this table shows you is that the radon, which is measured in becquerels per meters cubed, as the radon level goes up, and in Canada, we use 200 becquerels per meters cubed as our regulatory guidance level. So that's where we suggest that people take steps to reduce their exposure if it's over that metric. But you can see that as that number goes up, the risk of developing cancer goes up. And you might say, well, 4% risk of cancer, that's not much. But lung cancer remains the leading cause of cancer death in Canada. It's unfortunately not that uncommon. And so even a small increase in your risk is real, especially if it's preventable, is unnecessary. But then if you look over on the right-hand column, you'll see that if you smoke, it's a far more significant hazard. So the takeaway from this table is it's worse if you smoke than if you don't. But even if you don't smoke, the more radon that you have in your house, the greater the risk is of developing lung cancer. Next, please. So how do you get exposed to radon gas? I'm sure nobody on this call is a uranium miner anymore because we have a moratorium on that in British Columbia. But radon, again, it's a soil gas. So it's part of the breakdown of uranium, which occurs all across Canada to some degree. But it is higher, we know, in interior health. It's higher in the sort of diagonal strip that runs from the Kootenays all the way up towards Atlin. So there are parts of BC that have less, but yours is a region where we know there's more. So the radon gas in the soil, gases don't like to stay in the soil. They like to move. They don't like to be squished and cold. They want to be free and warm and move around. So the radon moves from the soil up and out. And if there's a house on top of where the radon is coming out of the soil, it will migrate indoors through cracks in the floors or walls and around sumps or drain pipes or anything that comes into a house. If it's not sealed underneath, the gas can get in. And we generally say that levels are higher in the basement or rooms that connect. If you don't have a basement, a ground contact level. Although depending on how you heat your house, that's not necessarily always the case. Next. So where do you find radon? It can occur in homes, but it can also occur in other buildings, including schools and childcare facilities. And then really any building, if it has four walls, a roof, and doors and windows, like maybe not a barn that's open, but if you have anything that's kind of shut down to the elements, radon gas levels can go up. Mobile homes, definitely we've seen elevated levels, especially when there's skirting around the bottom and things are sealed for energy efficiency. And that is one of the things we are really moving to make our homes tighter. And what that means is that any gases that are inside our homes can't escape out. So the gas can get drawn into a house and then sort of remain inside. And BC Lung has some research on that if you're interested. So because radon can occur in all sorts of structures, Health Canada actually recommends that all buildings be tested for radon. And in interior health, I think you're in interior health in Creston, or are you anyway, in interior health, they are testing schools and childcare facilities. So yes, in your area, there is an initiative to make sure that all the schools are tested. And there's a program in which daycare licensing includes testing for radon, which is, I have to say, unique. We are in this country one of the leading provinces in terms of actual radon policy because everyone's a bit behind us at the moment. Next, please. So unfortunately, radon is colorless, odorless, tasteless, and radioactive. So you're not going to know it's in your house unless you test. And one of the issues too is that your neighbor might have low levels or very high levels, but you can't really use that to extrapolate what your house is, in part because how that house was built might be different than yours. How it's settled could be different than yours or renovated. Some people have finished a basement, others haven't. And then how you use your house. So you might be one of those people that puts their quilts outside in the wintertime and airs them out and leaves the window open. Or maybe you're the family that keeps all the doors and windows shut to try and keep your energy bills down. How you use your house actually really influences the concentration of contaminants in the indoor air. And so that's why everybody needs to test their own home so that they can find out their own levels. And we actually suggest in Canada, which is somewhat different from our neighbors to the south. So just to say, they have a different way of measuring radon. In the United States, they use a picocurie, which is a very different unit. So if you are talking, because I know we're not far from the border, and they also have a Radon Action Month at a different time of year. But in the US, 4 is their regulatory limit, which converts to about 150 becquerel. So they actually have a more protective guideline than we do in Canada, and they test for different amount of time. But in Canada, we want to make sure that people test for 91 days. And might want to say, well, why would you do that for 91 days? And that's because the radon levels fluctuate. And we don't want to know what the highest level is, and we don't want to know what the lowest level is. And because it's a gas, gases wax and wane in homes. They come in and out, and they can build up or dissipate. And so we want to figure out, on average, what it is that you breathe, because that's in part how the health risks were estimated. So someone asked us on one of the last presentations, they had a radon pipe in their house, which is something that connects to the slab underneath with a cap on it. And they said, well, do I take the cap off and put the test above that? And no, you don't want to do that. You want to put the test in an area where you're going to spend time so we can get an accurate assessment of your radon level. We don't want to know what the worst one is, and we don't want you to put it on a windowsill so you find the lowest level. We really want to just understand what it is that you're exposed to every day so that you can make an informed decision about what it is that you need to do, if anything, with your house. In this program, we use what's known as an alpha track device. So this is actually a one-time device. It is one of the most accurate types of testing kits. And again, it just sits there. You don't need a battery. It doesn't plug in. It just sits there. It is non-toxic. If it's really mostly unbreakable. If it falls off the edge of something, you just pick it up and put it back where it was. This is a bit smaller than a hockey puck, the ones that we're using. There is a quality control program that goes on, and Pam will speak a bit more about that. But once these are used, once they sit and breathe with you in your house for that amount of time, they're sent to a lab, and then they check the inside to see how many pits are there, which are created by the radiation in the air, and then you get a number back. So you don't need to retest. Once you use these tests, you don't need to spend any more money testing. This test is one of the most accurate that you can get. If you've gone and got a device from the library already, one of these, because we have them available in your region, and then you've tested, then if you've already done that, you will likely notice that this test comes up fairly similar if you've left this for about a month. These are useful, these devices, but you need to leave them for, again, a fairly long time to understand how accurate they are. These are about 200 and something dollars. And for you this evening, these ones that you're going to use here are free. So we recommend that people use the test kits that we're providing in this program, but just know that if you've got one from the library, they're also accurate too, but just far more expensive. So again, the guidance level, as I'd mentioned, you're going to get a number back when you'll send your test kit off. And again, it doesn't have a fancy digital display, but you will get emailed a number back. Only you will know that number. That is up to you. And if it's below 200, that's better news. If it's 180 though, or 190, that doesn't mean that's great news. This is a linear dose response relationship. So the higher the radon level, the greater the risk. So 199 is not a get out of jail free card. It does mean that it's possible that small changes to your home could tip you over that level. So you might want to, if it is in the 180s and 190s, you might want to consider retesting. If it's above 200, that's where you want to consider fixing your home and putting in a radon mitigation system, which Pam will talk about. And again, the higher the level, the more urgent it is that you take action to reduce your levels. So in BC, again, I was saying we're kind of on the cutting edge of things. And over the last 5 years, I guess, at the BC CDC, a bit longer, we have taken data from testing programs that started in the 1990s. And we've pulled data together from school testing programs and research I've done at SFU and all sorts of different radon initiatives that have been happening. And we put it all together and aggregated it, anonymized it, and made it available in a map. So this is a publicly available resource. You can go and take a look at it. You can look at radon levels by local health area, by municipality, by health region. There's lots of very different information. You can look at it by the proportion of homes over 200. There's lots of different metrics because we have like some serious people with very big glasses that create this map and its resources. It's recently been optimized to work on a cell phone, which is great because now you can actually see it. You don't have to squint at it, but it is pretty fantastic. The data that we will be providing through this program, we do donate it to this basically a citizen science project. But again, it's anonymized, jittered, and no one can actually tell. You can't drill in and see anything smaller than the municipality when you look at the map. Next, please. And that's the URL. I can put that in the chat afterwards. The other thing that's amazing in this province, and it is a time-limited offer, so I encourage people to both consider this or talk about this program to your friends. In British Columbia, we are the first province to actually offer people a low-dose CT lung screen if you have a radon level above 800. And you might say, well, how is that possible? But unfortunately, in the Okanagan, we do see not an insignificant number of homes above that level. So if you have a radon level above 800, you may be eligible to get a free lung health check. It is not invasive. I went and had one done. It literally took 5 minutes. And what it will tell you is if you have nodules, growths, or cancer in your lungs, and it's free. So there's two sites that are offering this, one in Kelowna and one in Vancouver. So when you get your result, or if you've already got a result from the library with one of these, and it was around that level, I strongly urge you to reach out to the BC Cancer Agency. I'm always here to provide this information because right now this is a pilot to see if providing this kind of diagnostic service, which is not cheap and often hard to get, will be a helpful tool in reducing the lung cancer rates here in BC. And so just to give people an update, because you probably don't know, at this moment in time, over 33% of new lung cancer patients are non-smokers in this province. So it's still the leading cause of cancer death, and it's younger people that are getting lung cancer and people who don't smoke. So the province is on a program now to try and address lung cancer and see all the things that we can do to reduce people's risks, and testing and mitigating for radon it would be a really pragmatic big thing that people can do to lower lung cancer rates. So we have a national certification program, and I'm going to hand it over to Pam because she knows much more about this than me.
Great. Thanks so much, Anne-Marie. Yeah, so once you get your radon test report, then, as Anne-Marie talked about, if the levels are above 200, Health Canada recommends that you do take action to reduce it. CNRPP is our national certification program across the country, and you can go on the website and find a professional in your area to help you with reducing the radon levels. And when they do, the most effective way to reduce radon is radon mitigation. And this involves a pipe and a fan, and the pipe is installed in such a way that it goes through the concrete slab of your home and provides a pathway for the gas to go up and out. And so as you can see in the kind of simplified picture, the pipe goes down through the concrete floor into the space below, into sort of a void space. And when it's installed properly, ideally what we would like to see is that the foundation is well sealed so that it is just drawing air from one point, but under the slab, it actually pulls the air from the full footprint just from that one point. And this happens really efficiently if the slab is well sealed. And then it provides the pathway for the gas to go up and out where it's discharged and reduced to low levels when it mixes with the outside air. So we do recommend that you have somebody that's certified to make sure it's the proper pipe, the right size fan, that the discharge clearances are met, and that it is installed in the right location. When it is installed, there should also be some type of monitor on the fan to make sure that the fan is working, because it can be installed and you cannot hear the fan. In fact, my system, I don't hear it running, so I have no way to know it's running, but I do have a little manometer on the pipe that is full of liquid, and it's just a little bit off center. So one side of the U-tube is a little bit higher than the other, and that shows me that the fan is moving air. And if I were to unplug it, then it would kind of level off. Or the other picture here shows a system with an alarm. So it's not a little U-tube, but it's an actual electronic alarm that would sound a noise if the radon levels, or sorry, if the fan stopped. So these monitors don't measure the radon level, they just measure the fan moving air. Just to make sure that the fan's working. And once the mitigation system is installed, then the mitigation professional is responsible to do a short-term test to make sure that the fan is working and that the radon levels are coming down. But then you should follow up with a long-term test in the next winter. The same as what you're doing now, just make sure that you retest after a mitigation system has been installed. And if you don't have a concrete floor, then this could also be installed in a membrane. And so the pipe would go down through a membrane, and that membrane would be well sealed across the full footprint of the house. And it would be mechanically strapped or sealed along the wall, and then any access points as well. Now, that's for an existing home, but in BC, you have, and in the National Building Code, there are radon control measures. And in BC, this includes a granular layer as well as a full membrane, and then a pipe that goes down into the subslab space and then up and exits the building. And so this would be a full passive system if it's installed straight up properly. And this has been in the code since about 2018, and in various regions. And then in the last couple of years now, it's been applied across the whole entire province. Now, if you do need to install a radon mitigation system, the Canadian Lung Association has a radon mitigation grant that you can apply for funding. It provides $1,500, and in order to qualify for it, you need a long-term test, a quote from a CNRP professional, and then you also need a confirmation that you have qualified for it. And so you either need to qualify based on income, so you're under the median income for the province, and so you need to submit income confirmation, or you qualify if there is an occupant with a lung cancer diagnosis. And so you can find information out about this on the Canadian Lung Association website. Okay, so that covers the basics, the background of radon. So now I'm just going to go into highlight kind of the steps involved in the program. So after tonight, you'll be able to go in and pick up your radon kit, and the kits come in a little brown envelope like shown on the screen. Inside the envelope is the instructions and the kit. So when you take that home, we suggest you go set it up right away. And then you will need to log on and provide some basic information for us so we can make sure that you get that radon test report. And then at the end of the program, you're going to drop it back to the same location where you picked it up, and then the lab will send you a report. Okay, so let's walk through this a little bit step by step. So you go and pick up the kit from the office in Creston, and we'll talk about that in a minute. When you bring it home, you're going to open it up. So there's instructions inside, and then the kit comes in a clear plastic package. So you're going to cut open that package and take the black kit out, and that basically as soon as the package is cut open, it's turned on. So I'm going to get you to picture your home. So think about the basement of your home. And think about a room there where you spend 4 hours a day or more. So that could be a home office, a bedroom, a family room. And if you do not spend 4 hours a day in your basement, then think about a room on the main floor. So again, a home office, a bedroom, a family room are great locations. And then once you pick your room, then in that room, you're going to pick a location where you can put the detector. So think about a shelf, a bedside table, um, where it will stay for the 3 months. So if you have kids or pets and you're worried about that it might be moved, then you can put it up a little bit higher. You can also hang it from the ceiling, or you can hang it on an interior wall. But what you're going to do is you're going to pick one spot and you're going to leave it there, and you're going to test for the 3 months just in the one location. And then once you set it up, then as I mentioned, you need to record some information so that we can make sure that you get the report. So on each detector, there's a serial number, and we need that serial number as well as your name, your contact information, and your address. And then we also need the date that you set it up and started. And so you can go to the envelope, or there's a link in the instructions, or there's a link in the email that we send. So that'll take you to the start survey. And once you click on it, you'll see that there are those required information, which I've listed already. So your name, contact, address, serial number, and the start date. And then there's some optional questions. And so if you finish the required information, it'll say, is it, do you want to answer more questions? And you can decide at that point if you want to continue. The optional questions are things about your house. So we're doing a little bit of research on housing surveys. So things like, what year is your house constructed, or have you done any replacement of windows or furnace, or just things like that. And so if you want to, you can keep going, but if not, you can hit submit, and that's it. Now, 10% of you will receive 2 detectors. This is part of our quality assurance plan to be able to measure how accurately and precise the devices are measuring. So we do a number of different quality control checks. One is we send devices to the lab to have them expose it to a known level, and that's how we measure the accuracy of the detectors. And then the other is that we do duplicates. And so for 10% of you, you will receive 2 kits. And we ask that you open these at the same time, set them up side by side, and then on the start form, you will put in both serial numbers. And these will help us with measuring that the detectors are consistent, so the precision of the detectors. So we want to make sure that they're all measuring within the same amounts, consistency. And so we just ask that you put them side by side. So that it's not a bonus detector, it's not one to give to your friend or to measure up in your house. They just sit side by side together in that location that you've chosen. Okay, and then that's it. Then you're good for 100 days. If you have, and then at the end of the program, when it's time to return the detector, you can drop it off to the Creston library. Now you will see that the detectors come in a brown envelope, and on the outside of the envelope is a bit of a checklist. So it has your serial number, it has a location where you can put the start date, and then a location where you can put the end date. And you can keep that envelope. And so that is information that you can't remember later. So you'll be able to remember your contact information and your address, but you will not remember the serial number after you drop the detector off. And so we ask that you keep that until you get your report. And when you drop the detector off, you don't need to put it in anything. You can just drop it off in a box and leave it there. All right. And so Asha, are you ready to give us some instructions? Oh, you're just on mute, Asha.
Thank you. Yeah, I just wanted to point out it won't be the library drop off. It'll actually be picked up and dropped off at the Creston Fire Hall.
Good. Thanks.
5 Cook Street, if anyone doesn't know where that is.
Yeah. All right. Perfect. There we go. Okay. So you'll be able to pick it up from the Cook Street location. And then when you go to drop it off in March, it'll be the same location. You're right. Good. Thanks for that, Asha. Okay, and so then after you drop it off, we will make sure these detectors get shipped to the lab, and then you will get a report. So the lab will email you a report, and it looks something like this, and it will have a number on it so that you can see what the radon level was in your home during the time that you are testing. And as Anne-Marie said, this stays confidential for you, but we do summarize the information, and so we do share it with the map with the BC CDC, and then we also provide the community with a summary report. So we don't identify which homes, but we just provide the data on a summary. And so we will do that. Now, as part through the process, we will send you reminders, but we do find that emails go awry. So we are asking that you add our email address to your safe sender list so that you will get our reminders. So I'll put this in the chat a little bit later, but if you can just make sure that you check and see that you're getting emails from us, then that'll make sure that you continue to get them through the process. So we will send you reminders to pick it up. So after tonight's presentation, we'll send you a reminder with a recording of the presentation and a reminder to go pick it up. And then through the next week, we'll send you a couple reminders if we notice you haven't picked it up yet. And then once it's time to go and pick it up in 3 months, we'll send you another reminder saying it's time coming up to drop the detector off. And then again, the report will come by email. And so you can contact us and reach out to us at any time if you are missing any of that information. Okay, so did you have any, so we talked about the address and the hours. Is there any instructions when they come to pick up the kit, Asha or Vandana?
Just that it'll be, so bandana will be set up. There's a little room to the right just as you walk in the front door. So bandana will be there to help you as you walk in. So
Perfect.
just head to the front door.
Perfect. Good. All right. Okay. And then you this is Take Action on Radon. This is November, which is Radon Action Month. And so we would like to encourage you that you have been learning about radon and we want you to share what you know with your community. So your friends, your family, whoever, and then take a picture that represents that and you can go and enter our contest. So you can go to november.ca. So that's KNOWVEMBR.ca. And upload a picture, and you can enter to win some great prizes. We have weekly draws of $50 gift cards for Canadian Tire and Mark's Work Warehouse. And then we have grand prize draw of a stand-up paddleboard or a Fitbit or a KitchenAid stand mixer, and then other gift cards as well. So check that out, and you can enter, I think, up to 20 times, and there are pretty good odds. So you can take some time to enter it. Take Action on Radon is an initiative that raises awareness by working with others. So this is a great way that you can help us with raising awareness. And not only that, but if you go to the november.ca site, you will find our radon game. And so you can learn even more about radon. You can play our game, travel around a little virtual community, and it will ask you questions about different places and if you should test them for radon. So you check it out, and it will give you a bonus opportunity to enter the contest. So, and then share that with your friends, and let's see how many we can get. Oops. Okay, so we that is the end of the presentation, and so I will call on Anne Marie. Have you been Have you checked in with the questions at all yet?
I have indeed. I'm going to ask you a question and then I'll take a question.
Sounds
So
good.
one of the folks online has said that when they had tested in Calgary, they tested for a whole year. So what's the difference between what they were doing there and what we're doing here with the 91 days?
Yeah, so you certainly can test for a year. It's probably the same types of detector that you were using. We do the 3-month program testing. That's the minimum requirement with Health Canada. We find that more people are likely to remember to return it with the 3-month frame, and it gives a good representative of the annual average. We do find that the longer we go outside of the 3 months, that we have less return rate or lower return rate. So that is one of the reasons we do that. But the kits are good for a year. So if you do happen to keep it and forget to drop it off, you can mail it back to us at any time.
The question for me is, what if if you've never smoked, but you grew up in a house with smokers, does your risk to get lung cancer increase? And that is a really good question. The answer to that is in general, they don't know. Secondhand smoke is considered a lung carcinogen, but once people have quit smoking for 20 years, their lung cancer risk tends to go back down. So I suspect that if it's been more than 20 years since you've lived with a smoker, over time the lining of your lung regenerates, and so it's likely that your risk is not as high. So if you still live with a smoker, yes, you would have a higher risk, but I suspect that childhood smoking, or your exposure to secondhand, I'm assuming that you're an older person like me. Maybe if you're a very young person, the answer to that question is a bit different, but we don't get a lot of youth on these calls. So I'm going to say probably not. Okay, Pam, another question from Charmin. We don't use our basement, but it is fully finished. Should I put the unit in the basement or upstairs where we spend all our time?
Yeah, so that's a bit of a judgment call. We do talk about testing in the lowest lived-in space. So our recommendation is that you want to test your own exposure. So you would test in a room where you spend time on the main floor. But I mean, there certainly is justification. Maybe you want to use it in the future. So you're curious of whether the basement is higher as well. So you can certainly test down there if it's livable.
Interesting question here. We don't get this one often. Can radon gas from next door affect us?
Interesting.
Hmm.
So not likely. Even the radon mitigation systems, that's a question we often get because the radon mitigations come up and out, and so often are directed towards a neighbor's house. It dissipates really quite quickly, so it doesn't likely impact the home next to it. However, a radon mitigation system can actually impact you because it can remove the gas under the neighbor's home and it may also help with removing some of the gas under your home. So a mitigation system may positively impact the level of radon that's coming into your home, but it will not
Inc-
increase your radon. Yeah.
Is there a strict requirement, Pam, to return the device within 3 months, or can it go longer as I will be out of town and returning in March?
Yeah, so this we often get questions about people being away during the testing period. So if you miss the drop-off week, then that's fine. You can mail it back to us. It's like $3 in Canada Post. So just drop it in an envelope. Their address is on the instructions, so you can mail it back to us. If you are going away, though, for an extended period during the testing period, so if you're away for a week or 2 weeks, no big deal. But if it's starting to go on to a month or more, then you may want to either end the test early and send it back before you go away, or you may want to wait till you're back home again and put the test in then. Because it is possible that when your house is closed up, if no one is using the home, that the radon levels could be different than what they are when you're living in the home.
Yeah. With someone that's moving in December, so should they wait until they're in their new home to test? And I think probably yes.
Yeah,
Yes.
exactly.
Because then if there's something that needs to be done to you have control over what would actually happen.
Yeah.
Question for Pam from Jim. Are there certified radon professionals in the Creston area?
I believe there are, not specifically in Creston, but I think he's close by, right, Asha?
Yeah, so I can let Vandana speak to this. She was recently looking into this.
Yeah, so we have prepared a list of contractors who are working in Creston too. They are not based in Creston, but nearby areas. So if somebody's interested, I can share the list with them.
Yeah, yeah. And yeah, so we do have certified professionals in the area. And on the flip side, if you are in the trades and you're looking to become certified, we can send you information about how to do this. So there is online courses and information available. So we can add to that list too.
Someone's asked about positioning of the detector in regards to distance from ceiling, floors, or floors if you're mounting it on the wall. Pam has a great answer to this question. So.
Yeah. So on your instructions, you will notice that it gives you very detailed measurements. And these are all designed by somebody at one point. But we have done research to show that it actually doesn't matter that much. So we have taken 20 rooms in 20 different homes. We've put 20 detectors around all different areas of the room. So we've put them on the floor, we've put them close to the ceiling, we've put them in drawers close to electronics. And actually, all of the measurements came up within the margin of error for the device. So it actually doesn't matter. So we still guide best practice. Think about putting it in the location where you're breathing the air. If it's going to be go missing, put it up a little bit higher to make sure that it's there. Oh, we've also hung them on the wall, no problem. So there's 3 key things that we just give you guidance. Put it up off the floor, so do not put it on the floor. That's one thing that we did notice impacts the results. Don't put it close to a window, so there could be a drafty window, so put it a meter away from the window. And then don't put it in a drawer. So we did actually test drawers and most of them were fine, but we do know that some drawers could be more airtight than others. So we don't recommend putting it in something. So put it on the shelf, put it away from the window, and put it up off the floor. And really, that's really all that matters. So yeah, you can hang it now, even though it sort of violates all the little measurements. Health Canada is in the process of relaxing all those as well.
Interesting question, Pam. From Crystal, they recently had their windows replaced and they suspect they weren't done and sealed properly, but they're waiting for a resolution. But they may need to be reinstalled. Should they begin the test now or wait until their windows are properly installed?
Yeah, that's a good question. I guess it depends on how long it's going to be till they are installed and how much air is coming in from the windows, or how long, I imagine they'll be able to install them within a day, but yeah, I mean, it certainly could impact. We do know air tightness does impact the radon levels. So your windows not being very airtight could impact your radon level. So it would be reasonable to test when you know you're making a big change like that after the change is done, and then you know what the radon levels actually are in your new situation.
Yeah, it was actually, I was one of the people that did the energy efficiency research, and sealing of windows and doors was actually the thing that one of the biggest influencers of the radon level, followed by adding insulation to the roof.
Yeah.
So yeah, I think that's probably a good idea to wait until that happens.
Yeah.
Ballpark figure for having a radon mitigation system installed in an average house.
Yeah, so we did research between 2019 and about 2022 and found that the average cost of mitigation was about $3,000 across the country. Now, costs have gone up a little bit since then, so it might be a little bit more. And then also, we do find that if you've got a more complicated house, it could change the cost. So a large crawl space, complicated architectural, larger footprint, things like that may impact it, but it's about 3,000, which is why the grant is 1,500, because they kind of chose for half the cost.
Tell us about radon and the HRV, Pam.
All right. Yeah. So an HRV, so HRV is a heat recovery ventilator, and this works in tandem with your heating and cooling system. So it's connected in with your ducting system. An HRV brings in fresh air from outside, and then in return, it removes air from the house that's conditioned, and it does it in such a way that it transfers the heat. So ideally, this is a balanced system. So it brings in the same amount as it removes from the house. And so it should maintain, the same balanced pressure in the house. However, the air coming in goes through a filter, and sometimes that filter gets dirty. And so the amount of air that's actually coming in can be less than the air that's being removed. And so when this happens, your house actually gets out of balance. And so it actually could depressurize your home, which could then lead to drawing in more radon. And so the way that when you use it, we would encourage you to make sure that you clean the filters and balance it. But you may want to consider having an electronic radon monitor if you've got an HRV, and then you'll be able to monitor the radon levels for the whole time that it's there and see if it starts to go up. It's time to clean your HRV.
Pam, if you have somebody that lives in the basement area, should that be where the detector is?
Yeah, I would put that in a living space because people probably sleep for a good portion of the time they're in their house.
I'm going to answer a question, and the question was, is radon harmful to the environment? And as Pam, yeah, it's a good question. So as Pam had noted earlier, as soon as radon enters from the soil into the atmosphere, it rapidly dissipates. But there are parts of, for example, Saskatchewan, where the wind gets going in the summer and it dries the soil out and the soil cracks. And what that means is sometimes there's big streams of gas that can come up out of the ground at quite high levels. And it's interesting, if there's an earthquake or something else happens deep underground, it can change the way that the structure is underground, and then gases can move. So sometimes in the summer when the wind gets going, there can be high levels just above the soil. But once it really hits the atmosphere, like I said, it's a gas and it just wants to move, and the solution to pollution is dilution in this case. It just it just goes away back to being radiation. Like we have all sorts of other kinds of radiation in the air as well. So it is not harmful to the environment. People say it's a natural hazard, but the reality is it's actually a human-made hazard because the radon might be natural itself, but we build structures and those structures unfortunately retain the gas and that's where levels can build up. So yes, that's a very good question though. I don't get that one very often.
Yeah.
Another one for you, Pam. Oh, go
Okay.
ahead. Do you have one for me?
Yeah, well, the other one question we have is, does radon cause cancer in pets?
Oh, we were just talking about this.
Yeah.
There has been some research looking, so some of the original research when they were trying to figure out what was going on with the miners, they also did the sort of standard kinds of cancer panels with rats and mice, and then they tested beagles. So it turns out that if you expose beagles to radon gas, they do develop cancer, like a human, like they're a mammal, and so yes, beagles are likely representative of all dogs. The only animal that didn't develop cancer when exposed to radon gas was the hamster. So it's possible that hamsters are somewhat immune, but dogs and cats can develop cancer, and it's not infrequently that Pam gets a call from someone whose animal has got a
Yeah.
lung cancer or a snout respiratory cancer. And then, yeah, we have a program where people can access test kits too if they have a family member that has cancer. So yes, it does happen. And pets are often the sentinel, right? They're there in the home a lot more if they live there all day and that when people are out. So yeah, they're going to be exposed. It might be a bit of a canary
Yeah.
for the
Yeah.
analogy, but
Yeah, interestingly enough, we were just doing a community presentation for Sudbury, and one of the researchers was in our presentation. So that's why Anne-Marie and I were talking about this
yeah.
research. Yeah. Okay. There was a question also about should I run my HRV while doing the radon test? So we get these kinds of questions also, should I keep my windows open? So we recommend that you test your home as you live. So if you use your HRV, leave it running and leave it running at the rate that you would normally use it. If you, another question we often get is people open their windows at night in their bedroom. So if that's the way you live, then that's the way you should test. Maybe choose a different room for someone else. Maybe someone else keeps their bedroom windows closed when they're sleeping. So maybe choose their bedroom instead of yours to put the device in, but measure the way that you test. And then there was questions about moving the detector around, which I think we answered. So just pick one location and leave it there. And then there was another
A
question.
forced air furnace.
Yes.
Yeah,
Okay.
then the Q&A of a forced
Yeah.
air furnace. Should I place it near a vent in the upper floor that I spend time in?
So again, the lowest level where you spend 4 hours a day or more. Now, I think what you're implying is that the air is going to move around. And so, yeah, it's probably fairly even in all floors if you have a forced air furnace. So if you want to put it in your bedroom, then that's fine. Don't put it close to the air vent. So just put it, so don't hang it from the air vent. Maybe choose a different location, just a little bit of room away so that it's sort of a natural air movement in the room.
Darcy asked about mitigation steps they can take on their own if they're concerned. So I have put Health Canada has a guide for homeowners on what people can do. And if you are a DIY kind of person too, there's sort of a guide to reducing radon in your home. I don't know if you want to talk to that, Pam.
Yeah, I mean, this one's always hard to answer because we don't know what your skill sets are. But as Anne-Marie said, there is some guidance in that DUI guide. There are things like sealing up your sump pit to make sure it's not open, sealing cracks and things that you can always try. Again, cleaning your HRV is helpful. But yeah, we just want to make sure that if you are doing a mitigation system, you are coring through your concrete floor, make sure that you follow codes, that you know what you're doing and install it properly, which we don't know. So we don't usually recommend DUI for that.
Any other ones in the Q&A that have come in? Oh, can we get the presentation slides? That's a good question.
Yeah. So
We've
yeah, we will
recorded
share
the
it.
presentation.
Yeah, we'll record it and I'll throw them into this email so that you can have a copy of them as well. Good. Asha, did you have a question?
Yeah, I thought I'd hop in. I really, really appreciate the presentation so far. Definitely learned a lot from both of you, Pam and Anne-Marie, so really appreciate it. And the questions have been fantastic.
Yeah.
So they sparked a couple of my own questions. One being, after how long of being exposed to higher levels of radon would you consider it a risk?
Yeah, good question.
I can answer that question. So, because the occupational studies, they had records of how long people worked and then how high the radon levels were. And what they found is that the lung cancers developed within 5 to 15 years on average. So, this is not an immediately dangerous to life and health situation. So, if you work in occupational health and safety, right, there's things that like carbon monoxide where you get, but it is a chronic exposure. So, and again, it's people are spending more and more time at home. We know that Canadians spend 70% of their time at home, 90% of their time indoors. So we are breathing the air inside. And so it's really important for us to understand what is in the air that we're breathing inside because that's what we're actually being exposed to. So yeah, I hope that answered your question.
Yes,
Yeah.
thank you. And my second question, um, would testing be useful to do after a few years? Like, do levels fluctuate year over year? Okay.
Yes. If you lived in Alaska and there was an earthquake, they recommend that you retest after the earthquake. So there's a few things going on in Alaska. It's got permafrost layer over top. It is seismically more active than where you guys are. But the reality is that any changes, including drilling. So in Pennsylvania, where there's a lot of hydraulic fracturing, they have monitors and they can see that when people are drilling deep well injection wells, there's changes in the radon levels all from a radius around that. So yes, there is a really good reason for retesting, which is that the ground is always kind of shifting and moving underneath us. It's hot and cold, and it's getting hotter and colder, and that leads to fissures and all sorts of changes. And the gas can change over time as a result of that. So
Yeah.
yes,
So we usually recommend maybe every 5 years or something, just to make sure.
Even if the Earth was relatively undisturbed, every 5 years is still not
Yeah.
a bad.
Yeah.
yeah. Houses
Okay.
settle and crack like it's amazing.
Yeah.
Well, some do. The better yours do. I'm sure all yours are very well built homes.
Well, even my house. So my house did change, and I attribute it to the drought that was on the prairies. So we had a very wet few years, and then it was really dry. So yeah, things can
Thank you both.
change.
Pearson has asked a very interesting technical question.
Yeah.
Radon is an alpha emitter. So this is correct. Radon gas is a noble gas that when it decays emits alpha particle radiation. So yes, that is a very technical question, but thank you very much for asking that.
Another question is, do air purifiers affect the testing results? So the answer is no. The radon is inert, so it does not stick to anything. It doesn't get filtered out. So the air purifiers will not reduce your radon, and then they'll also not impact the test results because it won't filter out the radon.
No, it's not a particle.
Mhm.
Air purifiers are very good. I do wildfire smoke when it's not wintertime. I do radon research, and summertime I do wildfire smoke research. And I do particles in the summer and gases in the fall. So they work well for fire smoke, though. So if you
Yeah.
don't have an air purifier in your home, you can make your own, and I can show you how. But
Attend one of Anne-Marie's workshops. Yeah.
that's a workshop for another day when the weather is nicer. Okay, Naomi's asked, I have 2 sump pits in the house, which is an older home. Do I need to get them covered?
It's up to you. So we do in part of the new building code is covering the sump pits. And so it is one way that we recommend to look at reducing the radon that's coming in. If you want to test first and then close them if you have high levels, then you might want to test again after that. Or you may just want to look at sealing them up first and then testing. There are some pre-made covers. So if you go, there's a couple companies. So if you send me an email, I can send you some links to some companies that sell sort of some prefab covers that if it fits, you can take a look at them and you might put it over there, or you can sort of the idea is you have to fit it around the pipes and things coming out. So you want to make sure it's an airtight sealed cover. Another related question. If I spray foam my crawl space, will it reduce my risk? So spray certain spray foams have been shown to be a radon barrier. But the problem with spray foam, or the key thing with spray foam, is it needs to be installed properly, or else it isn't a barrier. So it would have to be all well sealed. It should be closed cell, so it needs to be the right type of spray foam. And then it needs to be done in such a way that there is no leakage, so that it's sealed all around. So yeah, there's different factors that go into it, but if it's properly done, it is possible to have a seal. But the other challenge is if you do need a mitigation system, then you may need to go down through into the crawl space and get under the space. So you may want to check with somebody who's certified first before sealing off your crawl space and making it inaccessible, because otherwise it might be harder to put the vent down through it. All right. Well, I think that is a good.
No, I got a question. I got a
Oh.
question. So the question is, I know that lung cancer is the main concern, but are there other cancers that can result from radon gas exposure? This is a great question.
Yeah.
Because the cancers can spread from one organ to another. It is true that lung cancer can metastasize often than it is to bone or lymph. But the other actual cancers that people are interested in are leukemia and lymphoma as a primary site. So there has been some, if you go into the published scientific research, Health Canada scientists have looked at levels of areas where there's higher levels of radon, and they have found higher rates of things like leukemia and certain kinds of lymphoma. These are correlational studies, though. The thing about the minor studies is they clearly knew exactly what people's exposures were, and then they followed them up. Those people, the ones that are still alive, are still in those studies looking at the outcomes for lung cancer. So we didn't actually, that is one of the interesting things about the research, is it was just healthy men that worked in these mines. So it wasn't children, it wasn't pregnant women, it wasn't women. So how radon gas exposure reacts to other things like women's bodies is kind of unknown. We are sort of the great experiment, but it would take a lot of money and time and research to be able to come up with a clear picture. So, and lung cancer is one of the most serious cancers that people can get because it is one of the least survivable. So right now, the best evidence is for lung cancer. It's possible that we'll see firmer evidence with some of these other cancers over time. But the really great news about all of this is that exposure is preventable. So it's much easier to reduce exposure to this than many of the other carcinogens that lead to lung cancer, including things like asbestos and arsenic in drinking water. Radon is much easier and cheaper to fix than those other problems. So that's part of why we do this work, is that this is sort of the low-hanging fruit for lung cancer prevention. And I just want to remind people about the screening program. Like it really is a big deal. If I was able to talk about that in another province, we have a whole other slide deck when we talk to people. Like we just came from Sudbury, and being able to have a check to make sure that if you have lived in a high radon region for a long time, your lungs are okay. Early detection leads to a much higher rate of survivability. And if you don't smoke, you're not going to get a free low dose CT. You're just not, because right now it's overwhelmed with people who are heavy smokers. That's the only people that get to use those machines. So even if you test low, but you know someone that's test high through another program, really, please be an emissary for this program, and let's get people through this system.
Yeah, good. Okay, yeah, just a couple more questions. One, I have a basement on concrete and then another room, main floor, also on a concrete slab. So I'm assuming these are sort of two different levels. Do both areas need remediation? Possibly, but not necessarily. So it is possible to mitigate just one area, and it may actually draw the air under the full footprint, even though there's multiple levels. So maybe, but not necessarily. And then what do I need to pick up a kit? So Asha and Vandana, you have a list of people that are on the registration list. So people can pop in and see Vandana, and as long as they let you know their name, you don't need any ID or anything, right?
Yep,
No.
that's right.
Okay. So, and we do have questions, if one spouse signed up, but another spouse is picking up, just make sure you've got the name of the person who signed up, and you can let them know. The kits have been all spoken for, I think. Oh, yeah. Right. And we have a wait list. Yeah. So, if you, right, so we did have, the program is for residents of Creston. So there was a few people I informed today as we realized that they lived outside of the area. So we have emailed all the people that are in the Creston area. If you didn't get an email from me today, then check your spam folders. You should have gotten an email, and that will tell you if you're on the registered list. I will also email out tomorrow to let you know that you can go in and pick it up. And so again, if you don't get an email, check it. And then I'll let the wait list also know that you can go in later. So we'll let the pre-registered people pick up. If there are some detectors left over, then we will email the wait list. And then they can pick up on a first come, first serve. After the week, if there are any kits left, then we will let others know. But as of now, all kits are spoken for. But if you didn't get a kit, you can go and buy one. So there are kits available online. Take Action on Radon. We list the providers, so you can buy one. BC Lung is one that sells them. And then Canadian Tire does also sell them. So if you're there, you can check that out. Okay, and that is, yeah, or the libraries have ones to borrow. All right, that is the end of our hour, and we spilled over a little bit. So thank you for all the amazing questions. That was great. Vandana and Asha, again, thank you so much for joining us tonight and helping us with this program. And thank you all for participating. It is our goal to help Canadians reduce radon exposure. And so we are really pleased that you are taking action and taking this seriously.
And thank you, Pam. It's what, 9 o'clock in Manitoba. So
Yeah.
thank you very much for all
A
that you
lot
do
of
for us
radon
here
talk.
on the West Coast. So we appreciate it.
Yes, thank you both of you. It was such a great presentation. Again, learned so much. I'm sure everyone here has, and I really, really appreciate your time on this.
Oh,
Wonderful.
thank you all. You're going to ace the census from here on in.
Yeah, all right. Thank you all and have a great night.